And welcome everyone to the SHMID webinar, Service Line Challenges Solved, How to Use Medical Claims Data to Power Your Strategic Decision Support. SHMID would like to extend a sincere thank you to the healthcare business of LexisNexis Risk Solutions for sponsoring today's program. A few reminders before we begin. Please locate the chat in the bottom right of your screen, and at any point, type your questions here as we've allotted time at the end for Q&A. This webinar is being recorded and will be shared with all registered attendees following today's session. At this time, it's my pleasure to welcome today's panel, Stephen Zackley, Vice President of Consumer Insights and Analytics, and Vanessa Villaverde-Volk, Director of Consumer Insights and Analytics, both from Lehigh Valley Health Network, along with Sean Larson, Senior Director of Healthcare Strategy, and Joe Finazzo, Senior Director of Sales Provider Market from LexisNexis Risk Solutions Healthcare. At this time, the floor is yours.
Great. Thank you, Stephanie. Good afternoon, everybody. My name is Joe Finazzo, and on behalf of Sean Larson from LexisNexis Risk Solutions and Stephen and Vanessa from Lehigh Valley Health Network, I wanted to say thank you for joining us for what we think is going to be an informative and enlightening session. Today, we will share how Lehigh Valley Health Network overcame internal data gaps, specifically in the area of provider claims data, to answer critical business questions and inform their ongoing strategy. Before we get started, we'd like to take some time to briefly introduce ourselves. I lead the provider market segment for LexisNexis Risk Solutions, and I've been with the company for over 13 years. I have a background in claims data analytics and provider data solutions. Steve and Vanessa, would you like to introduce yourselves?
Absolutely. Thank you so much. So I'm Stephen Zackley, Vice President for Consumer Insights and Data Analytics for Lehigh Valley Health Network. I have been in healthcare a little over 4 years now. I originally came from the automotive industry, where I spent a considerable amount of time doing consumer insights and data analytics work, both for retailers and for global automotive manufacturers. Thank you very much again for the invitation, and I look forward to participating. Vanessa?
Thanks, Stephen. I'm Vanessa Villaverde-Volk. I'm Director of Consumer Insights and Analytics. I've been in healthcare for over 15 years now, always with Lehigh Valley Health Network in various roles, starting as an analyst, and now I'm lead in terms of market intelligence. I'm responsible for market research and survey deployment and various other sundry tasks that come my way. I am also the lead in terms of developing tools that allow market intelligence to reach various customers of ours. Thank you for inviting me to join this panel.
Great, thank you. And Sean?
Hello, everybody. I'm Sean Larson. I lead the strategy for our claims data platform in LexisNexis. I've been here almost a year. Previously, I was at a large med device company where I managed a data and analytics team focused on turning this exact same data into insights and helping understand how patients move through the care continuum. I've been in this space about 15 years now, and I look forward to sharing the data background and insights that we've gathered here with all of you, and look forward to this presentation.
Great, thank you, Sean. So with that, let's flip to the agenda. So to start things off, Stephen and I will kick it off with some background. First, we'll provide a brief overview of Lehigh Valley Health Network. And then second, we'll talk about some of the questions that they were looking to answer and the challenges that they faced trying to answer them. Next, Sean will walk us through the types of data and analytics that were needed to fill those gaps, as well as LexisNexis's approach to claims data analytics. And finally, Vanessa will share how Lehigh Valley applied that data to answer some critical business questions and inform strategic planning decisions. Then, as time allows, we'll wrap with questions from the audience. With that, I will hand things off to Stephen.
Much. I appreciate everyone joining, and I would like to just briefly go over Lehigh Valley Health Network. So we are a health network basically around Allentown, Lehigh Valley, and just to the north and a little bit to the south of that area in Pennsylvania. This is, I guess, northeastern central Pennsylvania, however one likes to describe it. We're sort of equidistant from Philadelphia and as well as Newark, New Jersey. A nice area to live in, beautiful. We do have 9 hospital campuses, expanding soon to 11 as we integrate our coordinated health partners, and then hopefully continuing to grow and expand here in the Pennsylvania area. Again, as it says, we serve 7 counties, so we serve a little under 2 million people right now, again, hoping to continue that expansion. We have more than 2,800 clinicians on staff. A reasonably sized health network, and again, something that grew from what was really a single hospital campus over the last 12 years to a multi-campus facility spread across a very wide geographic area. And as that spread occurred, and right as that growth occurred, um, we had some real fundamental questions that needed to be answered. The first is very simple. Where are patient referrals coming from? We really wanted to understand, as we were looking at growth opportunities, as we were looking at expansion, where's our present base? Who's competing with us? What is going to be important in terms of maintaining our competition and our competitive abilities within our home market, but also as we look outwards at these new hospital campuses, what were we going to be able to gain in terms of referrals? And really that was a huge challenge. What physicians and physician groups, right, would we engage with for network optimization? Again, a huge question that I think for every network is probably out there, right? Who are the doctors that are critical to maintaining the network of doctors that you have among independents, even among the doctors that you're recruiting? Who's important? Who's critical? Really, that type of people internally have heard me use this, but it's almost a social network type analysis where we're finding out and we're seeing who the important physicians are, who's critical to convincing, talking to, and reaching out to, right? And that's really one of the key aspects of this data information and of this data. And then, of course, the last 2 questions, right, which is all about, right, as we look at the competitive landscape, as we look to expand, right, what do we want to expand into and where do we want to expand, geography, but also what services, and taking a look at what is being done in our area, but critically, what is out migrating, right? Who is sending patients out geographically from our service area, not necessarily even to our competitors, but far outside of our geography? What's leaving? Are there services that really the community that we serve needs because they are having to travel very far away, perhaps 45 minutes, an hour, hour and a half, maybe even 2 or 3 hours away in order to get those services? So do we want to think about including them? Do we want to think about starting new services? And those are, of course, also very, very critical and important questions. And as we go on, I'm sure everyone here, Vanessa, Joe, Sean, will all help connect us and answer these questions. And you'll see really how we put all of that very much into practice at LVHN using this great data set from LexisNexis. With that, I'll turn it back to you, Joe.
Great. Thanks, Stephen. So with that, as we move along on to the next slide, so Stephen outlined a number of key questions that Lehigh Valley Health Network was tasked to answer in order to set their strategy and identify opportunity and compete in their marketplace. And so to provide optimal answers to those questions, as well as the deepest level of insight, Lehigh Valley team really understood the need to access a broad data set that would answer those questions, a comprehensive medical claims data set for their region. And so with that, they knew that what they had internally wouldn't help answer those questions. At the time, they only had access to 2 primary sources of medical claims data. The first was an internal data set from the providers within their network. The second was state data that was somewhat limited to specific areas of care settings like inpatient, outpatient surgeries. And so it was really only a partial view of what was going on in the marketplace. The major gap was access to data from outside their network. So we're talking about physicians external to Lehigh Valley Health Network, like referral partners, and claims from outside facilities, including ambulatory care, physician offices, and other types of providers that were not part of those internal or state data sets. That holistic view of the geography was especially important to help answer some of the strategic planning questions. They needed data to inform growth decisions, an example being the acquisition and partnership with Coordinated Health a couple of years ago. Another area was the need for data both inside and outside of their historical footprint, so that they could better understand the demand for services and areas for potential opportunity. So like, for example, what Stephen mentioned earlier, in terms of identifying potential outbound migration, right? Where were patients going to outside of that historical footprint for specific types of services? Another factor contributing to their decision-making process was the need to find a solution that could seamlessly integrate with existing business development reporting systems and workflows. As Vanessa will touch on later in the conversation, she and her team have done some tremendous work there in terms of ingesting and building out a reporting platform to fully utilize this type of data. And so I look forward to hearing more from her later on in the conversation. The challenges that were faced by Lehigh were not unique to them. The majority of health systems lack a view of the entire marketplace. Traditional data sources will typically come up short in some fashion. So for example, internal data. It's obviously limited to the four walls of the healthcare provider. It also relies on extremely good data and process standards. It's the old adage, garbage in, garbage out, right? Secondly, you can access data through risk-bearing relationships, right? Like what you would be able to receive through an ACO with your payer partner. However, that typically covers just a subset of that patient population you could potentially service. So it only provides a piece of the picture. And then finally, public data sets, like what's available through the states or CMS. And these data sets typically lack some level of insight and fidelity. The areas where they typically come up short, like ambulatory procedures, what's going on in the physician office place, telehealth, for example, right? These are all areas that have seen tremendous growth over the past 5 years. That inability to see the full picture will ultimately limit the potential to make really well-informed, timely decisions. And with the financial stresses that have been put upon health systems over the last 18 months through COVID, the need to make those decisions is more timely or more important now more than ever before. So with that, I'm going to now pass it over to Sean, who will help explain how LexisNexis has worked to overcome those traditional data challenges through our innovative data sourcing and solution methodologies. So Sean, would you like to take it from here?
All right, so are you able to hear me?
Yes, we can hear you.
Okay, excellent. Can we flip to the next slide, please? So when we talk about the data, as Joe mentioned, it really takes a holistic view of data. And when you think about size in data, it does matter, but so does accuracy and how quickly you can retrieve the data. So we have the largest amount of individual data there is, and we bring that all together to help us identify key attributes for hospitals and physicians and integrate that into our 2.2 billion medical claims that we update yearly, and we have roughly 11 billion claims in our database that we're leveraging for projects like this with Lehigh Valley. The ability to take all of that data and blend it across both commercial and government data sources is an art and a science. It's one that we've been working on for a number of years, over 15 to be specific, that allows us to get the most holistic view of what's happening with a patient, with a given provider, and those relationships between those providers. Next slide, please. So pulling it all together, how do we capture the data? So breaking it down, the root of our data really comes from claims, and the claims are picked up in transactions from the provider to the payer. So we're able to see both inpatient and outpatient procedure and diagnostic volume. We're able to link those claims to not just the submitted aspect of the claim form, but then also the remitted or the paid aspect of that claim form. So we're picking up the diagnosis, procedures, the drugs that are administered by a healthcare provider. We have insight on patients around age, gender, the location of the patients. We have the payer information, who paid on the claim form itself. And then we have the practitioner and the facility information. Next slide, please. So really, as you break all of that down and pull it together for the comprehensive view of what's happening with the patient, you're able to now track things like how many procedures are done by a given facility, by a given HCP. With over 11.5 million HCPs in our database and 1.8 million of those having active claims, it gives you a really good insight of really what's happening with those patients. We have 1.3 million facilities in our data set, with over 400,000 of those processing active claims. And we have over 1,000 IDNs in our provider master file data set. Again, as I mentioned, we bring all of that together, blending both government and commercial payer data, and we integrate a holistic view of what's happening at a federal and a state perspective as well. With over 240 million unique patients, you can really start to hone in on what's driving care across multiple different areas, geographies. There is no bias on the geographical location of those patients, procedures, or diagnostic data sets. And as I mentioned about access, we're able to provide that in up to a 4-day lag from the time the data is integrated into our systems, enabling you to really create actionable programs off of the data in near real time, air quotes. And as I mentioned, pre-adjudicated and adjudicated claims in that data set. And really the expertise of pulling all that together and the enabling of bringing your ideas to our data allows us to provide very complicated co-occurrence modeling as needed. So if there's a procedure code that needs to have multiple different diagnoses applied to it, or diagnoses in order, or inclusion or exclusion criteria, we are subject matter experts in that space. And we provide that through customized platforms that we deliver, as well as the data that we're talking about today. Next slide, I'm going to dig into briefly the 3 areas of data that we're talking about today. So the volumetrics data is really all around the healthcare provider and what they did from a diagnostic and procedure perspective, where they did it, and the number of either procedures, claims, or patients that they actually saw for any given code. Next slide, please. We're also looking at the networks. So how many patients did a physician refer to another physician? We're able to look at that from a couple different perspectives. We have what's actually on a claim form, and we're able to show that. And then we also see a relationship between actual shared patients and a diagnosis that happens with a physician and a follow-along procedure that happens with another physician and those shared patients. So we bring that together in our view of networks, both implicit and inferred referrals. And next slide, please. And for our provider partners, what we look at here is pulling together an output that has predefined service lines. So if you're thinking about orthopedic procedures, for instance, and you want to understand everything that's happening within that service line within a hospital, we have both the service line and the subservice line, a far more detailed version of what's happening from a claims code perspective, already pre-bundled and pre-configured, making it easier for you to take that data and apply it directly to your business problems related to that service line that you manage. And then I'll turn it back to the Lehigh Valley team to talk about the results of what all this data can give us. Vanessa?
Thank you, Sean. So to start off, when you do make a connection with LexisNexis and achieve a rationalization of what data you're going to get, you get millions and millions of records of claims data that is all valuable and good. But then you have to take into consideration, how are you going to actually get these data at the hands of your customers internally, who may not be well versed in searching through lines of data to get to the information that they actually need. So I had a good head start in that I have already been in I've already been involved in actually making these platforms that allow my customers to filter down to the data they need. So what I ended up doing was utilizing that framework and applying it to the LexisNexis data as often as I could. And what you're seeing here is the front page, the front door of basically the LexisNexis platform that I provide to my customers. The intention here is to allow my users to level set themselves, orient themselves to the market that they're interested in, and also the service lines that they're interested in first, in an effort to initially get their head straight in terms of what they're looking for. Because if you present too much data to your customers, they're not going to focus on what exactly they need to focus on. Now, once they do, then they can actually achieve pretty valuable results in terms of how physicians connect to each other in the market that they're interested in and get to the answers that they need. So given this particular example, in this case, the user is interested in the Lehigh market, and then they can then go to the next slide, and then you can see some details in terms of who's referring to whom, what affiliations they have, and what does that mean downstream for any of the organizations within the service area. In this case, you're seeing a quick summary for the orthopedics service line, showing the top receiving providers in the market and how many patients they share with the referring providers that are associated with them. Now, the user in this case may decide they need to filter in a little more on the answer that they're looking for in order to get the answer that they're looking for. They could say, okay, this is nice to know, but we actually are more concerned about leakage. Okay, so this is where they can dig in and see which of the referring sources could be producing potential leakage within the market, and potentially dig in a little deeper to see what might be causing that leakage. Things of that nature are particularly valuable for my liaison customers who are tasked with facilitating relationships between providers and our independent providers in our service area and the specialists in our network. The other way that you can use these data are to identify potential opportunities for expansion. What does that mean? Okay. So as Stephen identified earlier, you may be interested in leakages that isn't necessarily happening within your service area, but that's leaking outside of our service area into more distant organizations. So once you identify that, you can identify who are the referring sources for that leakage, and then identify whether it's a situation where you're just not providing the service, or more often than not, you are providing the service, but there may be an information gap in terms of what the referring providers are aware are available in the area and what actual services are available. The other way that this may be able to be used to identify opportunities for expansion. So one particular example that comes to mind. So we are in the process of building new hospitals, as Stephen identified earlier. And one of the hospitals that we're building is far outside of our usual reach in our service area. So if you're going to build something that far out, you're going to have to gain market intelligence in that area that you may not be particularly familiar with. And this is where the LexisNexis data can be additionally helpful, because in that case, we don't really have much internal data on the market, and you can get a sense as to who the most important players are in that market and who do you reach out to in terms of the services you intend to integrate into that market beyond what you currently have. Next slide, please. Now, beyond physician-to-physician network information and hospital affiliation that can provide insights as to what kind of facilities consumers may be utilizing their healthcare. Other examples of questions that we may get, particularly from our physician group, are those which physicians should we engage with for network optimization. Beyond physician-to-physician relations, you may actually want to see how individually important a provider is in the market, how occupied they are, what kind of patients they take care of. And the LexisNexis data has been particularly valuable to that end. You can see many things about an individual physician. You can see what service lines their patients may be utilizing. You can see what settings they're treating patients in. So you can see if a particular physician is more of a hospitalist versus a standard practicing physician. You can also even see, get a general sense as to the panel's payer mix, which may inform how you engage with the physician and what services may be of import to them. So given that, how do you actually get to this point? How do you actually get to this final product? So there are a few steps in place. You first have to have a good sense of the data engineering. If you can go to the next slide, please. So once you get these data, you have to take these data and package it in a way that's consumable to your customers. That required a lot of filtering on our part. For example, we want to make sure that the final product was answering most of the questions that would come into play, because I am a lead of basically 3 analysts, one of which is dedicated to only market research. And there is not enough hours in the day to allow for all the questions in the network to be answered by our team. So given that, we focused on a particular geography. We filtered down to the claims that are related to that geography. We optimized the network-to-network, the network information between providers to make sure that the types of specialists are being connected to the appropriate types of referring physicians. We engage with our customers to make sure that the front end of what they're seeing makes sense to them so they can extract the information that they need from it. We also engaged with which customers need to see more information and made available opportunities for them to engage with myself or my analyst personally to get the more detailed information that isn't necessarily available in the dashboard on a timely fashion. It's a work in progress. It's always going to be a work in progress, and we're always working on making additional views and platforms to make new data available to all the various customers in the network. It's always been an enjoyable process between my team and my customers and with our contacts at LexisNexis to achieve that end.
Well, thanks, Vanessa. Hey, I have a question actually, and just
Sure.
to say too. I mean, Lehigh Valley has been a tremendous partner, so thank you as well. You mentioned customers, and at one point I think you mentioned the physician liaison groups. what are some examples of some of those customers within Lehigh Valley Health Network that leverage this data?
Absolutely. So actually, I'll pick on the liaison physician group first because they were my first customers. So it's a team of 6 liaisons right now, headed by a manager, and their critical piece in this particular example is that they need to know who to talk to. They need to know how to talk to them. And they need to know what's going on with the folks in their accounts to basically be able to best engage them for various matters. So they are high-end utilizers of my dashboards, including the LexisNexis based dashboard. And they frequently engage with us in terms of any of the interesting trends that they notice in the data. And they have probably the best understanding as to how to utilize this data so far. So I will move on to the physician group, since they were actually the reason why we even gained access to this data in the first place. So their primary focus is on leakage, growth opportunities, location optimization, and potential acquisitions. And given my discussions with them, it appeared that the framework that I'd already built for the liaisons would work for them with a little tweaking. Beyond that, we also have customers in business development who utilize it to better inform folks who require orientation to new markets that we intend to develop. They also utilize the data in a similar fashion to the physician group, targeting potential acquisition opportunities, or if acquisition isn't possible, partnership opportunities. We also have customers in marketing, though their use case is a little interesting. It's just basically generally informative. They're not going to make any decisions based on physician to physician research, but they just want to generally have a sense of how the market is performing. Oh, it looks like we had a question from John Crow. How do we track pediatric providers? Now that's a challenge. So, so let me back up a bit. I mentioned one analyst who is dedicated solely to market research and particularly physician inventory in our market. So one way that we do track pediatric providers is simply we just know who the pediatricians are and who the pediatric specialists are, and how they connect to each other. But as we know, pediatric utilization doesn't always fall within the bounds of pediatric providers. We have pediatric providers being seen by family medicine specialists. We have pediatric patients being seen by what we would typically call adult specialists that also take care of pediatric patients. Given the way that the claims data comes in now, we don't have any demographic information on the patients themselves. But given how our relationship has been going with LexisNexis so far, we have asked for custom extracts that focus just on the pediatric population. So you can get a more holistic sense as to what's going on in that particular realm.
And not knowing the background for the question, but I do know, so historically, pediatric data has been somewhat challenging, and I think that's been partly a function of the types of data sources that have been available. And so, having said that, the pediatric population is 1/5 of the U.S. population. So by nature, you're going to have less of that information. However, from the standpoint of accumulating that data, aggregating that data, insights into pediatrics is an area that LexisNexis does help their customers with. The other thing I wanted to bring up, Vanessa, was, and I'll throw this question out to you and Stephen. So obviously we're operating here at the time of a unprecedented pandemic. The questions that you outlined earlier, in terms of understanding referral leakage, trying to better identify opportunities for growth, these are questions that are typically asked, in and out of a pandemic, right? But I guess just to maybe help understand a little bit better, how has COVID-19 impacted the need or urgency, or how has it impacted overall those questions that were being put in front of you?
Well, outside of the initial scramble for information on how prevalent COVID-19 is, we'll get beyond that right now because that's not necessarily the topic of terrible interest right now. After it hit, the biggest questions we received were basically related to how quickly are we going to get back to normal, or as close to normal as we're ever going to get. So in that sense, that was a challenging question, given that we really didn't know how lengthy the pandemic would impact us, and is apparently still impacting us. But the way that the LexisNexis data has helped us to that end is to basically measure claims compared to pre-COVID normal utilization as a way to basically determine how things are progressing, how the public is responding to the pandemic, and how that's changing, how that initially changed their utilization choices, and how that's starting to resettle back into normal patterns. I think I got to the spirit of your question.
Yeah, no, that's helpful. And I think a lot of providers were faced with the same, question in terms of, what do volumes look like now? How are things trending? Are what we're seeing at our hospital system, is that indicative of what other providers are seeing, whether you're talking about a specific, service line or specific area of care? I know that we've worked with a couple of organizations over the last 12, 18 months, doing some analysis around orthopedics, telehealth adoption, a number of areas, and so some insightful things we've pulled out of that information, that trending data specifically, around what those volumes look like. And I know it's not here in the deck, but we can make sure that we share this with all the attendees. LexisNexis had put together a COVID resource center, which was an online site where we pulled together a number of data attributes related to both our provider and claims data sets, as well as some of our patient data sets. So obviously not the topic of conversation for this discussion, but to help provide some insight into different pockets of the country where there were areas that needed to be acted upon from the need for provider coverage, for example, or one area we looked at was in terms of telehealth adoption within the throes of the pandemic, which obviously we all saw massive spikes there. So we'll make sure to share that with all the attendees here today. All right, great. Okay, so with that, I guess let's progress, and we'll talk about some summary points here, and then we can open it up to some general questions from the audience. All right. Okay, so to wrap things up, your challenges aren't unique. COVID-19 has created challenges for every health system out there, but regardless, right? The financial strain, the adoption of digital care, the stop-starts from a surgical perspective, they're all unprecedented. Every health system's trying to restabilize and re-strategize to compete and provide the best possible care for their patients. Your internal data, though, is not enough. Internal claims and internal provider data, or even publicly available data sets, they're not enough to provide the insight you need. There will be gaps, whether these are gaps in the services that are being covered, or gaps in fidelity, or gaps in frequency and latency. Either way, these data sets will only provide a piece of that picture. And lastly, external partnerships can help. Supplemental data, specifically medical claims data, can complete that picture. It can inform your market strategies and ultimately unlock growth opportunities for your organization. So with that, that concludes today's presentation. We hope you found it informative and valuable. And with that, we would like to open it up to any questions from the audience.
Thank you for that excellent presentation. We do have some questions in the queue. The first one is, how do you handle data access or report requests from different groups within the health system?
I can speak to that. So generally speaking, we don't want to keep data out of the hands of anyone who needs it. We want to make it as available as possible because that's how good decisions are made. Informed decisions are made that way. So basically, the only thing we really need to know is that the user has a valid reason for using the data. Otherwise, they basically just go through a process of learning about the data and how to utilize it and what do certain things mean and how do you interpret certain numbers that you see in the data to make actionable decisions. But otherwise, we basically keep it open to everybody.
Yeah, I
Great.
would just add the whole idea of making the data available via portals, right? And having a graphical user interface is really important. We spent in Vanessa spent a lot of time talking to and designing really an interface that helps multiple groups access the information. If you take a look, we have a system that is really geography based at first, practice based, doctor based. So there's a bunch of ways to, we could say, not necessarily a great choice of words, but where you can attack the data and get at your question. I don't want to in any way make it sound like this information is too complex to use. It's not, but it is important to think through kind of how people ask these questions before you just start running through this data set. And what's been really nice is LexisNexis has been there as a partner throughout this. So when we've run into problems, where we've run into questions, they've been there to help answer those. And that really brought us to that final point, which of course was some of the examples that Vanessa went over earlier in this presentation. So I would not underestimate the ability of the LexisNexis team and kind of the other users of this information to kind of help make those determinations and make those design choices so everyone can actually use that information.
Great. And a somewhat related question, but perhaps you could shed some light on how you're tracking patients across multiple providers.
Oh, I see. Okay. So it's difficult, even with the way as easy as the LexisNexis data makes it to look at the claims data. We don't have, unfortunately, any demographic information on the patient. So we cannot track any individual patient from doctor to doctor. We can only make inferences based on the magnitude of the patients being shared. It looks like, Sean, do you want to chime in here?
Yeah, so that's accurate. So our data is identified at the physician level and at the healthcare organization level, and we have de-identified patient data that we aggregate up for those volumetric outputs that I was referring to earlier.
Yeah, and just
that's
oh, sorry, Vanessa, go ahead. I cut you off.
No, it's okay. I just wanted to chime in. It's not something particular to the claims data. I mean, any market data that you have access to is going to have that problem where you can't track individual patients. Unfortunately, it just violates HIPAA standards. But I mean, there are ways to get around it. I mean, you can try to basically get the general proportionality of what you're getting out of the claims data or any other market data you have, and try to marry it to your internal data to verify certain thoughts that you may have on the subject. But that solution doesn't exist as far as I know in terms of actually tracking individual patients around.
Yeah, I mean, Vanessa touched on a couple of the points here regarding the HIPAA protections that we need to put in place, from the standpoint of we are looking at medical claims data here, even though de-identified medical claims data. So, to that point though, there's different ways of getting into some of that detail, right? So, in terms of looking at what is available on the claim. So, as Sean mentioned when he was summarizing some of the volumes and influence network capabilities regarding how we can look at specific types of procedures or types of conditions based on diagnosis code. And there is ability to look at some of the demographic, obviously not at a patient level, but we can look at things, and I know Vanessa mentioned this earlier, in terms of being able to identify maybe at a pediatric level, right? So amongst this cohort of pediatric patients, where are they going? From Dr. A to Dr. B, or from facility X to facility Y, things of that nature.
Great. And the next question is, how are you able to make the internal case for an external data solution purchase?
So I'll oh, go ahead. You want to do it, Vanessa? You could go ahead and
No,
answer. I don't mind.
I was really going to volunteer you, Stephen, because
Oh,
by the
okay.
time that I was part of the process, it was already it already been decided by all the SVPs and chairs that we needed this.
Which makes it sound like, of course, Vanessa's needs weren't involved, which that wasn't the case. I think
No.
so there was there was a vast recognition across the organization that we had to have a source for claims data. I, again, coming from the automotive industry, continue to be surprised at the dearth of data that is available that tells us what our patients, consumers, however you'd like to look at it, even clinicians are really doing. And this was one of the most comprehensive data sets available. It did require a little bit of more work, I think, on our part to bring up a user interface, but it also meant that we had an amazing data set that allowed us to gather insights that I think just aren't available if you buy something off the shelf, where the claims are, we have all this analytic work done, we're going to tell you everything you need to know, because it never really turns out that way. So I was just interested in this data from a let's understand what's going on from a competitive perspective, from a claims perspective, from a consumer perspective, and a clinician perspective. And then you add into it now our ability to leverage kind of this, again, this social network analysis and identifying who the most important doctors are, and so on. So it was not a very difficult sell process for us. I can say again, I think from a perspective of completeness, support, certainly from the LexisNexis team, this is certainly one of the best products out there. And we looked at a whole bevy of people that wanted to give us claims data and provide it across the spectrum of prices and data availability. But certainly LexisNexis came out as probably certainly the best in our view, but definitely fulfilled all of those needs and requirements.
Great. And this question is likely for Sean. Is LexisNexis claims data all claims and all payers?
It is a great representation of all payers. There might be some small payers that we're not picking up. It is not all claims, so we're not census level, but we are capturing, depending on the disease state that we're following, roughly around 80% of the marketplace, maybe just a little bit less than that on average.
Thank you. And the last question we have at this point in the queue is, can you share any or shed any light on the currency of the data? How current is it?
Yeah, as I mentioned, it is in the most recent offering that we have, we can give it to you in as little as 4 days from the day it is actually submitted for payment from the provider. In this case, I believe the Lehigh Valley data set was updated on a quarterly basis in our database.
Yes, we received the most recent quarter update last week, if I'm correct. Now the time frame of the data, as far as I understand, would be all claims recorded through June of 2021, which is about 6 months more recent than what we have in one of our market data sources, and about a year more recent than another one.
Yeah, you're correct,
Yeah.
Vanessa. We run roughly that lag as we process all of the data from all of our sources and pull them together.
Yeah, to that point, Sean, just to piggyback, right? It's that, and I think somebody actually asked a question to that point, right? It's that completion part, right? So the data solution that Sean mentioned in terms of the 4-day lag, right? That's a solution where the intent is not necessarily to cover as much of the market activity as possible, but to cover what's happening kind of at the tip of the spear, right? As soon as that activity is occurring. And we call that market view early alerts. In terms of our other solutions, like what Lehigh Valley is leveraging today, it's more about comprehensiveness, right? And in order to provide the most complete view of, say, a given month's claims data, from a representation standpoint, just due to the lags in claims billing, that can't occur, the day after that month ends, obviously, right? From a data processing and aggregation standpoint, we need to wait to a point where we see about complete coverage of that month, right? And that's where that lag period comes into play. But it's by design from a data science perspective.
Great. And that is all the questions we have in queue. Before we wrap up, I just want to pass it to the LexisNexis or Lehigh Valley team for any closing comments.
So here, I'll take it from the LexisNexis side. So I want to thank our partners at Lehigh Valley, specifically Stephen and Vanessa, for their participation here today. For everybody in the SHSMD audience, I hope that you found today's conversation valuable, from the standpoint of hearing a hospital system talk to some of the questions that they were trying to solve for. I'm assuming others had the similar types of questions, right? So you're not alone in that. Better access to a complete picture would improve your planning, your processes, and so forth. So, with that, just again, thanks to Stephen and Vanessa and Sean, and we appreciate you guys attending here today.
Thank you. And just echoing your thanks to both the Lehigh Valley Health Network and LexisNexis team for sponsoring today's program. A copy of the recording will be shared with all of you. And if we didn't get to your question today, feel free to reach out to the folks on the screen or provide your contact information via the survey that will pop up. The link is also in the chat. And if you'd like a copy of the slides, please leave your email in that survey. Thank you so much, and we will see you again soon.